Many Australians today will be listening on in their home cities or where they live while they are subject to COVID restrictions. That is particularly the case in my hometown of Sydney, which I will be returning to later today after having been at the G7 and then, of course, going through the quarantine period here in Canberra. This is a difficult time when people are dealing with the restrictions, but that has been our experience over these past 18 months as our country has battled COVID-19 like every country has. Every country has had their share of success and also of failures over this period of time. COVID-19, managing your way through COVID-19 is uncharted waters. And anyone who thinks there is always a pathway that is without risk, that is without vulnerabilities, clearly doesn't understand the significant challenge that all nations face in dealing with COVID-19. But those who understand this best are Australians who deal with this every single day. And today was an important meeting of the National Cabinet. It was our 45th meeting of the National Cabinet. At no time in our federation have state premiers and chief ministers of our territories and the Prime Minister met together with such frequency to deal with a national challenge, a challenge that has gone on now for a long time, and there is still quite a journey ahead of us. And we will continue to meet, and we will continue to work together as best as we possibly can to ensure that Australia's COVID-19 response is world-class. Today we reaffirmed our commitment to that task in the National Cabinet. But we didn't do that just in words, we've done it in deeds. The good news I have for Australians who are subject to restrictions today is we have agreed a new deal for Australians on the pathway out of COVID-19. A pathway from a pre-vaccination period which is focused on the suppression of the virus, on community transmission cases, to one that sees us manage COVID-19 as an infectious disease like any other in our community. Now, there is still some pathway from here to there, but the pathway we have agreed today, I think, gives all Australians encouragement and I think much needed hope in what has been a very difficult time. We have affirmed today a plan that has 4 phases that will be finalised in coming weeks based on the expert medical evidence and modelling work that is being done by the Doherty Institute and channelled through the task force that was established some months ago to do this work, that first initiated that work in relation to the Alpha strain of COVID-19, and that was reported to National Cabinet several weeks ago, and now is finalising its work on the Delta strain. The plan has 4 components. The first of those we are currently in now, and it is based on the agreed principles that were set out before National Cabinet that I took to them today. So we agreed to formulate a national plan to transition Australia's national COVID response from its current pre-vaccination settings, focusing on suppression of community transmission, to post-vaccination settings, focused on prevention of serious illness, hospitalisation and fatality, and the public health management of other infectious diseases. We agreed in principle that that plan consists of the following phases, each triggered by the achievement of a vaccination threshold expressed as a percentage of the eligible population, that is 16 plus, based on the scientific modelling conducted for the COVID-19 risk analysis and response task force that I've referred to. The first phase is the one we're in. Vaccinate, prepare and pilot, where we continue to suppress the virus. That involves the implementation of the National Vaccination Plan to offer every Australian an opportunity to be vaccinated with the necessary doses of the relevant vaccine as soon as possible. And Lieutenant General Fruin will update you on that. But today we'll be seeing another record day of vaccinations. Today, we will hit 8 million. 8 million doses administered, and that means 1 million doses in just 8 days. In the month of June, we hit almost 3.5 million doses. Purely achieving that rate of vaccination between now and the end of the year, with the additional supplies that we are expecting over the course of this year, we believe will put us in that position by the end of this year. To temporarily reduce commercial inbound passenger arrivals to all major ports by 50% from current caps to reduce the pressure on quarantine facilities due to the increased risks of the Delta strain of the virus. Now, while the reduction of those caps will certainly, right across the system, obviously take some pressure off, as we have observed over the course of these past 18 months, that alone does not provide any fail-safe regarding any potential breaches. We've seen breaches occur predominantly as a result of infection control procedures and human error and so on. Those issues need to continue to be strengthened. So simply reducing the caps doesn't necessarily provide a fail-safe, but because of the particular virulency of the Delta strain, it is believed that that is a prudent action while we remain in this suppression phase of the virus. Lockdowns in the current phase to be only used as a last resort was agreed today. The Commonwealth will facilitate increased commercial flights. Those are those facilitated commercial flights that we have been running to increase international repatriations during this period of reduced caps at the commercial caps at the major airports, and they will be channelled into Darwin for quarantine at the National Resilience Facility at Howard Springs. So where we will lose some capacity for inbound flights of those coming back through commercial flights, the Commonwealth will directly seek to mitigate that by upping, wherever possible, those commercially facilitated flights that the Commonwealth is pursuing. Now, I would note in recent days and weeks that we have seen demand for those facilitated flights run by the Commonwealth having actually dipped. And so those flights we've been bringing in have not been full because there hasn't been the demand to take those up. Now, I suspect that will change now with the commercial flight restrictions. Then we will see that supply being fully taken up, and we will be enhancing that, increasing that from major ports to ensure that we can keep the pace of bringing Australians home. We will also extend the international freight subsidy scheme to ensure maintenance of essential freight supply lines by air impacted by the reduction of commercial caps at international airports. As I stressed today, reducing the caps of commercial flights will come at a cost to the Commonwealth Government. So this is not a costless exercise. Medicines, vaccines come in by plane. Essential freight comes in by plane. So the Commonwealth's decision to support this reduction in those commercial caps comes at a fiscal cost to Commonwealth taxpayers. But we agree that it is an important part of managing this most virulent strain during the course of this suppression phase. Over the course of the current phase we are in, that we will trial and pilot with individual jurisdictions the introduction of alternative quarantine options, including home quarantine for returning vaccinated travellers. The work that we have already done, and Professor Kelly may want to add to this, shows that a vaccinated person doing quarantine for 7 days is stronger than an unvaccinated person doing quarantine for 14 days. So there's clear medical evidence to suggest that vaccination means that shorter periods of quarantine is possible without any compromise of the health and safety standards that is currently delivered by a 14-day quarantine for unvaccinated persons. So getting vaccinated actually clearly helps, and the medical evidence backs that up, particularly for quarantine. South Australia has indicated that they will be seeking to work with the Commonwealth, having the necessary digital applications to support that. It would be a very small-scale trial, but we want to make sure that before it goes to any scaled-up use, that we have worked through that, and this will be a very transparent exercise with other states and territories. We will continue to expand the commercial trials for limited entry of student economic visa holders. A number of states are doing that. And so we will recognise and adopt the Commonwealth's existing digital Medicare vaccination certificate that is automatically generated for every vaccination and registered on the air. So that is something that's already there now. By the end of this month, as I've said to you before, it will be at another level, which would see it being able to be incorporated in things like Apple wallets and the like. That we will put in place a digital vaccination authentication at border, that we will prepare now, as we already are, the vaccine booster program, and there will be a further review of the National Hotel Quarantine Network to ensure that the standards, infection control procedures and the like are being adhered to. That's phase one. That's the phase we're in. That's the suppression phase. That's vaccinate, prepare and pilot.